Hey everyone, so this is a video about wrist activation. So we know that a lot of the instruments that we use require wrist activation, either very gentle movements, require a lot of stability with our wrist, forearm, and whatnot, but also some of our scalers require wrist activation. Let me grab one real quick. So a scaler, such as the, what is this, SN137 from Hu-Friedy, this instrument would also require wrist activation. They're going to be short little bursts, and they require kind of a relax and roll in your adaptation, that kind of thing. But what I really want to focus on right now is just wrist. Okay, so lots of reasons why we need to move our wrist. To get the hang of it, you'll need to just remember teeth are shaped very round, okay, or elongated or ovals. They're not just going to be one flat surface, so it's not going to be one specific movement that will accomplish everything. It's not just moving the instrument with your wrist like this, because I mean, look at that. What kind of movement is that? That's not going to do anything. A more suitable wrist movement is required for multiple surfaces. So an exercise you can do for that is imagining a clock. I know we already have clocks as far as like our seated position, but stay with me. So imagine that you are landing at the center of a clock and you're tasked to rock or kind of fulcrum in the direction of every hour using your wrist activation. So this would be 12. I'm pointing towards the patient's nose. This is 1, pointing to the corner of their eye. This is 2, maybe towards their ear. 3 o'clock, towards their commissure. 4, 5. Try and accomplish every single one of these types of movements just so that you are feeling loose and you're ready to kind of accomplish some of these extra movements that you may not even be thinking about. We want this to be so acceptable, an acceptable movement for you to be able to accomplish given any area in the mouth. We want you to just focus on your adaptation so that when you're actually performing your adaptation, you don't care which area you're moving in with your fulcrum. Instead, you're only focused on adaptation and angulation, of course, if you're using a sickle. You see, I'm here first, and then by the time I'm done, I'm here. So there's no reason to kind of get hyper-focused on, now I'm doing a 6 o'clock wrist rocking motion, and then, 4 o'clock or 5 o'clock or something. No need for that. It's really just so that you kind of get your muscles used to making any type of wrist activation movement. There's going to be some drastic areas that you might feel stuck. Well, maybe you are moving in the wrong direction. So anyway, your focus should be adaptation, and if you're using scalers of any kind, add angulation to that. But your wrist should be very mobile. A student recognized it as being like a joystick. It needs to be able to move in a joystick type of way and help you navigate the correct adaptation, the correct angulation for your patient's comfort and for effective scaling. Okay, that's it on wrist activation.